This is Bump and Beyond with Yolandi Becker is brought to you with compliments of Discam Baby City.
Good morning, good morning, good morning. It's that time of the week again where we're talking all things parenting with me, Yolandi Becker, on Bump and Beyond, here on 101.9 High FM. Today's show was brought on by the fact that normally I feel that, especially when my children were younger, now that they're a little bit older, I do have to say it is better. But it was always like around March, my children would get sick and then, or start with a snotty nose, let me say that. And it will kind of progress and other things would happen or not, hopefully. But then here around September, I always found that things do start getting a little bit better again. And I've always found also, again, as my profession with clients, I've always found this to be true as well. But this year, I don't know what is going on. It seemed to be going better in September, and all of a sudden, all these, I don't know, germs crawled out of spaces, and I feel there's so many kids and people who are sick at the moment. And I don't know if it's normal or not, but I've luckily brought in the big guns today, and we are going to be talking about these common baby illnesses and what we can do. So again, like I'm saying, I've got the big guns here. So as always, I do want you to be part of the conversation. So if you have questions for my guest today, Dr. Enrico Maraschin, who is a pediatrician at Mediclinic Morningside, please start sending in your questions. He can answer them for you. Of course, you can, as always, telegram us on 061-895-1019, or you can SMS us at 34519. SMSs are charged at R1.50. Again, of course, if you feel inclined to do so, sending a lot more information, you can do that on our email at instudio@highfm.com. But as I mentioned, the pediatrician joining me and my expert today, who's not only a pediatrician, he's also a father, Dr. Enrico, Dr. Rico as he's known. Welcome for joining me again.
Thanks, Yolandi. It's always great to be here, and nice to reach out to a greater audience. Always nice to try and make people a bit further from the centers in contact with us, and great to be on your show.
Yes, and that's also one of the things that I think makes you such a legend. Firstly, the fact that you've probably been in private practice almost 30 years already. And the other fact is that you're always so keen as well to share your knowledge with people. And you've got a great way of also dumbing it down for us non-doctors, which is also fantastic. And I think that's a gift. So please keep on adding to that. And thank you for that. If you don't know, Dr. Rico also has a website. So you can go check out all the many blogs that he has. He also shares a lot of information on different platforms. So please go check that out as well, because it is really, he's keen to share and he's got such a vast amount of knowledge. But as I was mentioning before I started gushing about him, I was mentioning to you before, I don't know if it's just my imagination, but is it really like, I feel that there's so many sick kids at the moment.
Yeah, so Yolandi, when I first started private practice, I thought, I'm going to work all winter and rest all summer. But really, the illnesses are out there most of the time, and you do have ebbs and flows. And I remember the one December, we had more pneumonias in December than we had the whole of winter, So if the bugs crawl out the woodwork, they're there and they travel, and it's so multifactorial as to what causes these problems. We can't really say it's one thing or another, but the bugs do travel rather efficiently, and, bugs do need to be, looked after. And, our respiratory system is, exposed to liters and liters of air every day, and those are full of little respiratory droplets from other people, and we do get infected. And then also our tummies, we're exposed to lots of things through our intestines. And so we're exposed all the time, and there's this ongoing battle between the body's immune system and the bugs that are trying to invade us. It's almost like a full-on war all the time, and if there's a breakdown anywhere, if the bugs are either stronger or your body's weaker, then we're going to start seeing these illnesses, and that's what happens. If it's crawled out the woodwork, we're going to get infected, and we've got to look after the bubbies and make sure they get through it.
Yeah, and I mean, you've mentioned one thing specifically is about the traveling, and I think now we're properly back to normal, people traveling all over again. And I see it also even with my husband when he's traveling for work, and now again, literally came back with the sniffles last week, which is still, I don't feel like he traveled abroad or anything necessarily, but he came back and now he has the sniffles, and I feel he's targeting us. I'm hoping we're going to avoid that. But it does actually have an impact, especially if people are traveling to places that are in the northern hemisphere where there is now winter. They're coming back and then they infect the rest of us. Thank you very much.
Yeah, look, and that was well demonstrated during COVID. We all wore these masks and we practically didn't see any ill people. And look, it's not good for our immune systems to always wear masks. I mean, that was a very specific reason why we wore masks at the time. But you do realize how much we exchange. I often tell parents, they're sitting opposite me at my desk and we exchange the same air, so if I've got a bug, you'll pick it up and vice versa. And the international travel definitely plays a big role in bringing bugs in from one area to the other. And I think the how quickly COVID spread throughout the world can just demonstrate how easily that happens. And even if you shut a country down, the bugs still got there, so they do travel. And I'm a great protagonist of vaccination. So if you really want to know what keeps your kids very healthy is to make sure their vaccine schedules are up to date. If they're up to date, there's X number of bugs that they're really not likely to get. And so that's why I encourage moms to always make sure that their vaccine schedules are up to date.
Yeah. And I mean, that's such an important message. Me too. I'm also a big pro vaccinator. In all honesty, my kids still every year get the flu vaccine to protect us. And even though my son still gets it every year, I do feel that it's milder symptoms that he gets when he does get it. The rest of us never. I don't know why, but he's the one. But we call him the weakest link in our family.
Look, when I was in final year specializing, we did, I looked up the causes of tummy upset and there are hundreds of bugs, and there's no way we can immunize to every one of those. So the only way we protect ourselves is to be exposed to those bugs, develop immunity, and ultimately then the next time we're exposed to that same bug, we'll have immunity and it'll protect us on the second exposure.
This is Bump and Beyond with Yolandi Becker is brought to you with compliments of Dis-Chem Baby City.
Vaccination. Welcome back with me, Yolandi Becker, on Bump and Beyond. And if you've just joined me, don't worry. You've only missed a small part, and luckily it's available as a podcast afterwards, so you don't have to worry about missing anything in essence. Today specifically, we are talking about common baby illnesses and what you can do, how you can identify it, when you need to freak out, when you don't need to freak out, all those things. And as I mentioned before, I've got the big guns here, and pediatrician Dr. Enrico, or as he's known, Dr. Rico, who is in private practice at Mediclinic Morningside. Dr. Rico, before we went to the ad break, we specifically spoke about, in essence, we are exposed to, like you said, all the time, to different bugs. But what are some of the most common baby illnesses that you have in your practice? that you see?
Look, most illnesses that we get are in fact viral, and the predominant ones are going to be respiratory because of what we were saying earlier, that we exchange a lot of air and respiratory droplets going in and out of our system, and then the tummy bugs. Those are really the big ones. The skin is also a barrier to infection, but luckily we don't see we don't see as many infections of the skin as we would the respiratory system. So, the viral causes of upper respiratory colds and flus, people call a lot of the upper respiratory systems flu, but, there's so many other viruses, and flu really generally makes you very ill. So a lot of the illnesses you were mentioning that your kids still pick up despite the flu vaccine, they're not really flu. They might be a rhinovirus or an adenovirus or, parainfluenza viruses. So there are many viruses out there, and they all cause a similar type of syndrome, and then the nose becomes infected, and sometimes then, because your body's low with the immunity, you'll get bacteria that then take advantage of your body being a bit lowered immunity from the viruses, and that then ultimately sometimes it requires more aggressive treatment than just symptomatic treatment like antibiotics and so on. And then the tummy upsets. I mean, we all know, the kid wakes up at 3 a.m. and it's vomiting repetitively, and then it develops diarrhea. You were mentioning my website. Please go to my website at 3 a.m. because, your doctor might not be available, and the website tells you what to do if you got a temperature and if you got vomiting and diarrhea. It's just enough to get you through to see your doctors in the morning or your healthcare professionals. So those are really what takes up a lot of our time, and that's where a lot of the vaccines are also aimed at, to try and prevent your kid from having to go and see the doctor quite so often.
Yeah. And I mean, it's interesting now that you are, mentioning the tummy bug. For me, I feel like especially when it's like these hectic temperatures where it becomes so hot, like 38, and I always feel it's like my son also, again, our weakest link, he always gets a little bit of an upset stomach when we have these high temperatures. But in the back of my mind, I'm always wondering, it's like people always like, oh, you're going to get a cold because it's cold and things like that. And then I'm like, temperature doesn't make you sick. Viruses and bacteria make you sick. Or is there a truth to temperature makes you sick?
I think, I say there are two groups of doctors. There's those doctors who've got a good immune system, and they're very anti-believing that catching a chill makes you ill. And that might be correct. I've got a cousin, he can walk outside with shorts and t-shirt on a very cold night. He'll never get ill. But I've got a very weak immune system. If I go out there, I can assure you the next day, I've got the virus, So it depends on the individual. I think, and that's where medicine's also going nowadays. It depends on who you are and what your makeup is. And as we said earlier, it's very complex. And it doesn't mean because one person doesn't get ill when they're exposed to cold that another one won't. So it's very individual. But I think, you do have to look after yourself and try and, limit your exposure. I mean, obviously if you can walk with shorts and t-shirt on a cold night, well, you can do it, But if you're the guy that gets ill, well, maybe mommy's right. Put a jersey on, the famous saying, you put a jersey on when your mother's cold,
That's true. I had that same experience exactly this morning, but anyway, my son did decide not to go out with a jacket, and I think it was actually the right call. Anyway, another temperature that we need to talk about is, of course, the actual temperature of the baby. I have to say, that's for me the whole point of this conversation is for parents to kind of also know when they should be worried and when they shouldn't be worried. I can very distinctly remember, and I'm very sure I've told this story before on the show, is that the first time my son actually got sick, he was, I think, 18 months, or when he got a temperature, he was 18 months. And honestly, it was a very low degree. I think it was 38 degrees, but I completely freaked out. I immediately gave him Nurofen, but I also rushed to the hospital. Of course, by the time I got to the hospital, the Nurofen had started working, so there was no temperature when I got to the hospital. But when should we be worried with the temperature? When is it just a low grade? Obviously, this is a way for the body to react.
Basically, you also got to remember there is such a thing as a low temperature, and in a very small baby that may also be relevant. So temperature below 36 degrees, might be on the low side. So there you might have to wrap your baby and make sure maybe the child was exposed to some cold. Then 36 to 37 is really where most people's temperatures are going to be sitting. And before you get to a fever, there is this gray zone between 37 and 38. So I think in my mind, once you're 38 degrees, there is something going on, that's causing a fever. But that's not a high fever. So 38 to 39 is sort of lower grade temperatures. 39 to 40 is starting to be a high grade temperature. And look, above 40, the alarm bells must ring. You got to get that temperature down, because there is such a thing as called the fever fits, where a high fever, especially if the fever goes up very quickly, the child can have a propensity to develop a convulsion. And for me, that's the worst thing a parent can ever witness, because when that happens, you immediately think you're going to lose your child. But luckily, it's not something that happens. Children with fever fits, if you get medical help, it's not going to take your baby's life, but you do have to control the temperature at that point in time. So what we're trying to do is prevent you getting to that point where, your child's in danger. And that's where you're going to use, when it's low grade, you'll use a paracetamol. And when there's a high grade, then you'd use an anti-inflammatory, which would include, ibuprofen. So I must say, I'm quite aggressive at controlling fevers in my practice, and I think that's why I don't see too many fever fits in my practice. But in areas, where maybe people aren't treating as aggressively, you may see those. But any doctor's going to see a fever fit from time to time. And then, the other warning signs, I think the mother's neck is a good point of reference. If you're hot under the collar, there's a problem. Don't ignore your instinct. Every time don't ignore your instinct. If you instinctively as a mother think there's a big problem, rather check it out. Because a small problem checked out is not a problem, but a big problem not checked out can be a problem. So look out for warning signs, a lethargic baby, crying continuously, not able to do anything, not able to eat, not able to drink. Also a baby who, is sleeping very long. People think, oh, well, the baby's being very good. It slept for, 12 hours. Well, maybe it's not waking up because it can't wake up. So those are all warning signs that must say, hang on, mommy, like you're hot under the collar. It's time to get to the doctor. It's time to check this kid out.
Oh, and I mean, like you said, the temperature, like I said, I completely freaked out about the temperature that I had, but I've been more informed. And that's why it's such an important thing for parents to know when kind of the lower grade, the higher grade, and what to do. If you've just joined us, I am speaking to pediatrician Dr. Enrico Maraschin specifically about baby illnesses, common baby illnesses. As always, I want you to be part of the conversation. So if you do have any questions for him or for me, or just to share something that has happened. Maybe you've experienced a high fever with your child and you freaked out or didn't. Maybe share that with us as well. On Telegram, you can send us a telegram on 061-895-1019, or you can SMS us at 34519. SMSs are charged at R1.50. Another thing with fevers though, because now you talked about the lower grade between like 37, 38 or 37, 38, 39, and then the higher grade, over that. Should you be more vigilant when the baby's smaller? Is there a time when they're a little bit older where you can be less worried about that? Where you can just treat it at home? When should you be rushing to the hospital?
Yeah, look, I think if you've picked up a temperature and you've tried to control it, I always start with the low grades with paracetamols, and if it's not winning, then add the anti-inflammatories. But there are two factors. If it's an older kid even, and you're not winning, you need to sort it out, because someone's got to guide you as to the way forward. And also to make sure that there isn't something more sinister on the go. And then on the high grades, look, smaller babies, are more at risk. So one doesn't want to ignore the smaller babies. So babies less than 3 months of age, the immunity, they do have the mother's immunity when they're born, but that gradually wanes, it wears off, and then the baby has to develop its own immunity. So they are a little bit more at risk when they're less than 3 months of age. But nonetheless, I mean, even an adult who has a fever of 40 and it's ongoing and so on, don't ignore it. There may be things that are happening,
ever had a child with a 40? I think I would literally freak out with a 40. I think the highest I've experienced was close, like 39.8 maybe, but sure. I would think that the red already, when it makes red on the thermometer, my head is like, my eyes become really big and I become very worried. You mentioned earlier as well that some of the most common things obviously that you see is like viral infections with upper respiratory things as well. And that brings in coughing as well. For me, always, doctors will say like, if you go to the pharmacy and you want to get cough mixture, and it's like, is it a dry cough or is it a wet cough? And I'm like, always like, I'm not 100% sure what the difference is between a dry cough and a wet cough.
Yeah. So look, different, the same bug may manifest in different ways, but I think, when you're dealing with kids, a very harsh dry cough can mean that their actual voice box is infected and inflamed, and that often is caused by croup. And croup is a very dangerous condition because if you have what that classically causes is a child battling to breathe in and out, and I often sort of imitate to the parents what that sounds like, because if they know what they're dealing with, then they can act on it. So if the child's struggling to breathe, and I'll make the noise, that when they're breathing in and they start going, or they might be breathing in and out in the same way, or then they start struggling to breathe, that is definitely an alarm bell. You cannot ignore that dry cough. That you've really got to get to your nearest casualty. And unfortunately, this usually happens at 2 or 3 in the morning. And parents are, no, we'll wait till tomorrow till the doctor's awake. No, that's one cough that you don't ignore. And when the baby coughs, it'll often sound like you've got a little dog in the house. So is a ha. So if you see that's all starting to go down, if it's 2 in the morning, don't be considerate of anyone. There are casualties that are open. Go to the casualty. They'll sort you out. That probably is croup.
Yeah. Then my daughter also had croup, and I mean, the first time I heard that, it's hectic. It's really scary. Get a big
very scary. And then look, the wet coughs, it means there's more phlegm and more inflammation. And, at that point one might need to, treat with appropriate medications. And look, I find every doctor's got their little preference for how they're going to treat it and how they're going to approach it. And obviously one of the big things that doctors have got to contend with is, the resistance to antibiotics. So, one doesn't really want to jump into antibiotics straight away, especially for the fact that maybe even up to 80% of illnesses when they first present are viral. But, should it progress, should it lower your immunity, should it not get better, should the child keep deteriorating, then that does become an issue. But I think, everybody would have their little preference on how they're going to treat. Croup would be clear cut. You have to treat quite aggressively, and the doctors will know what medications to use in that setting, and sometimes it also involves nebulizing. Then the wet cough, different people treat differently, and then ultimately, if you're going downhill, not winning, one might add antibiotics down the line.
On the note of like lots of phlegm and stuff like that, another very common thing, obviously, and which is often a bit of a struggle with little babies, is snotty noses. Of course, babies breathe through their noses most of the time, or they should be breathing through their noses most of the time. But if their noses are stuffy, this can have an impact on that. Lots of products these days that you get these cool nose sucking devices that you can get. Are these safe to use? Can we use them? Should we use them? Because I found them quite helpful, but I've also read some things that it's not a great tool to use.
So look, I mean, if the nose is very obstructed, one's got to try and open that up. So if it's not a big deal and you're starting out, you could start off with some saline. And so what the saline does is it breaks down the little bonds that make that mucus sticky. And if it's sticky, you're not likely to sneeze it out or cough it out. So at that point, put it in, see if it works. The child may sneeze. Sometimes they may even swallow the saline, which makes them cough a little bit, but that's not the end of the world. It's clean saline that we're using. So don't be shy on that. That's a good place to start. But if the child's really battling to move air through the nose, and children do prefer to breathe through their nose, mouth breathing is more difficult than nose breathing for children. So, if you're not winning, then one can look at the more aggressive treatments, including decongestants to start with. And then, it may progress depending, because decongestants can only be used for 5 to 7 days at a time. You can't push them longer. So if you are struggling beyond 5 to 7 days with a very congested nose, it is also time to consult a healthcare professional at that point in time. And then look, if you, not winning altogether with a nose, so when one get recurrent illnesses and you can't breathe through your nose at all, one must remember that there is a little structure called the adenoid that sits at the back of the nose that serves a very similar function to the tonsils in your mouth. So that one protects the bugs coming in through your nose, and the tonsils protect the bugs coming through your mouth. So those are called the adenoids, and those can obstruct your nose, and those do need treatment if they become an ongoing issue.
I'm learning as well so much, and I'm just glad I don't have a small baby anymore. I have to say that, because for me it was really one of the most stressful things when a baby got sick and you can't ask them what is wrong. And I do also have to say, even when children now, my kids are already 10 to 12. My son now has started to say more specifically what is wrong. But also for a very long time, I felt like all illnesses manifested as stomach pain. So any kind of time when they were sick, they always mentioned that they had a stomach pain. But more on that just after this break.
This is Bump and Beyond with Yolandi Becker, is brought to you with compliments of Dis-Chem Baby City.
And just like that, we are very strongly running out of time again today, which is good because it means that we've learned something today, I guess. I've been speaking to Dr. Enrico Maraschin about specifically common baby illnesses, how you treat them, when you should be freaking out, when you should not be worried. So if you've missed it, of course, you can catch it as a podcast on chaifm.com. It wouldn't be a problem, and because all of my podcasts are there, and also all the other shows that we have on ChaiFM is also available on chaifm.com for you to go listen to at your own convenience as well. It's really great. Dr. Rico, before we went to the ad break, I was with my daughter. There was a long period of time where she actually like all the time, any kind of illness I felt like was manifesting as a stomach pain. Is that a thing, or was that also again one of those things that are my imagination?
So if you think of adults, if we complain, we normally complain of a headache.
Yes.
And for children, they don't often complain of headaches, even though they do. Occasionally they complain of headaches, but they often would manifest with tummy pain. And, it can just be a general part of what we call malaise. Malaise means you're just feeling run down and ill and not well. But the other components of tummy pain is if it's a virus, it might also be involving, the glands that are in the tummy, or it might be that when you've got a high fever, when you're generating a high fever, the blood supply to the tummy is cut off, so that the blood supply goes to the center center part of the body, where you then build up that fever. And that in nature would also then cause a tummy pain. So if you've got a fever and you've got tummy pain, you know that it's all part of the whole dynamic of getting the blood to where you need to generate heat to make the fever. So yeah, kids, there are two components. There's the headache component. They don't get a headache, they get a tummy pain. And the other one might be if you are developing a fever, you're cutting off that supply to the intestines, which is a non-essential structure. And all the blood supply goes to, you know, the core of the body, the center of the body where you're trying to generate that fever. And that, you know, would of course generate tummy pain.
Ah, see. And I was always like, because initially I just remember that I was always thinking like, how can they have stomach pains all the time? But now, and then I learned over time. So a very big tip for moms out there. It's not always maybe an actual tummy pain. It could be something else that is manifesting. It's very interesting. Another big one on that note of actual tummy pain is constipation. Before you go, we can talk about that as well. Constipation is also, I feel like, a big thing with babies. And for me, the interesting thing as well that I experienced as a mom, also again recently, even with older children, is that sometimes we can incorrectly think our children have diarrhea, and then it is actually constipation.
Yolandi, I think we need a whole session on this, because if you ask me, this is the pandemic of pediatric illness. You know, in the bad old days, and I don't condone forcing kids to eat anything, but kids were forced to eat fruit and veg. But, you know, we dealing with Generation Negotiate. They'll negotiate any deal with any parent or adult or whatever. So in other words, they don't eat fruit and vegetables. And that's where it's at. But that's a big pandemic. I see kids with severe tummy pain. And as you say, the reason they've got diarrhea when they're constipated is the hard stool blocks the intestine, and then there's nowhere for that stool to go, and the stool above that stool ferments, and they get what's called overflow diarrhea. So the diarrhea runs past that hard stool, so you still got this cork blocking the whole system, but you get the diarrhea that floods past it. So now you're treating this child for diarrhea, you're trying to bind up the stools, and meanwhile, all they really need is to pass this hard piece of stool so that they can actually move on with their life. But it's a big pandemic. I'd actually encourage you at some stage to consider having a whole session on that, because
I would love
to. Big problem, and we need our dietitians to come and tell us what we're doing wrong. You know,
I would love to have a session on that, specifically just so that I can say poop a lot on live radio. That's a pet love of mine, to say inappropriate words on live radio.
Yeah.
But
and you won't mention the pictures, I guess, because my parents want to know, is this okay or isn't it okay? But it's because they're worried, and there is definitely scope for helping people in this regard.
Is there a red flag when it comes to the coloring of a poop? Is there a color that you should say, go to the hospital now?
Yeah. Well, look, poo, people worry a lot about the color, but the very serious colors are in a very small baby white, because no poo should ever be white. That means there's a digestive issue, especially in a very small baby, less than 6 to 8 weeks of age. Then, blood in a poo is always a problem, and a very black poo, other than in the newborn period. Newborn babies, when they first spot meconium, it can be black or dark green. But, a black stool in an older child can mean digested blood. So those are definite warnings that, this is time to get medical help, But look, the constipation is often not as big a problem as that. And luckily we don't see too many kids with those big problems, but the constipation is a big problem. It's definitely, we battle a lot. And it's mainly because we're not balancing our diets with the right amount of fiber, and there's the soluble and the insoluble fibers and so on. And that's why sometimes we do need dietitians to advise us, how much soluble fiber, how much insoluble fiber, do fruit and veg all day. The more fruit and veg we eat, the healthier we are,
Like you said, a good conversation for the future. I'm already put it on the list of discussions.
Excellent.
Before you go, Dr. Rico, one last thing. I think you've already mentioned one thing that is important, but what is your top, preventative mechanism to avoid common baby illnesses?
Yeah, I think, so the only things that have been bigger than vaccination has been, having running tap water in a house and sanitation in a house. Other than that, the next biggest, step forward for humanity preventing illnesses is definitely vaccination. So, we're always happy to hear that there are more and more vaccination stations out there and people getting out there and having their vaccines. Those are definitely antibiotics. They treat illnesses, but they've also made a big impact on treating illnesses, but they haven't made an impact on preventing illnesses.
Great. So Dr. Rico, it's been so wonderful having you as always on the show, and we've already got something lined up for the new year as well. I can't wait for that. But before you go, you are in private practice at the Mediclinic in Morningside. What is your website details?
So it's actually, if you just look up Dr. Maraschin, so DR, and then space MARA, and then my name pops up there, and the website, will take you there. But it's, Dr. Maraschin at, drmaraschin.co.za. But, and there's lots of info there for parents. And if it's not on my website, it will be on someone else's website. So don't be shy. I know the new generation, they're not shy of getting the information electronically. Don't be shy to get information off, the media. There's a lot of good, helpful information out there.
Great. Thank you so much for joining me.
Thanks, Yolandi, and thanks for the invitation. Really appreciate it. Have a good day.
This is Bump and Beyond with Yolandi Becker is brought to you with compliments of Dis-Chem Baby City.
And just like that, another show is done. And it was a wonderful one today. Even I learned a lot of things, and was reminded of so many moments in the past where I did not know all the right things to do, because as a mom with a small baby, it is so easy to freak out because unfortunately they can't tell you what is wrong. I mentioned that my daughter eventually started telling me her tummy was sore, but it's a long time until that happens. When they're small, I would say 18 months, they couldn't, it's only from 3 they could start verbalizing when something was wrong. You know your child. Follow your instincts when it comes to that. And I hate saying that to parents because and I've said this before, I've never really thought that I woke up one morning and I knew what to do. I've learned, and this is what this show is all about, is informing you with great content to help you through this parenting journey. As always, don't worry if you've missed a show. It will be available as a podcast with various other topics as well, available for you to go check out on highfm.com. If you've got any specific topics that you want me to cover, I know in the past someone has also said introduction to solids. We've now got constipation as a whole topic coming up. Next week specifically, we will be talking about sleep, about newborn sleep specifically, how their sleep works, how you can handle those situations, what you should do to better their sleep, and. So if you've got questions on that, please be sure to send it to us. We would love to answer them and, talk to you about your newborn sleep, or if you're pregnant and you're stressing about that initial, because I think that's one of the main things people tell you when you're having a new baby is you're not going to sleep, as if you're not been sleeping because you're pregnant, and your sleep is very far and in between. one of the big things that I want to leave you with is the doctor even said that is that the best way to prevent illnesses and common baby illnesses is to keep your vaccinations up to date. So please go out to the Dis-Chem Baby Cities. They do the full schedule, government and private schedules, where you can get them at any clinic. And I can tell you, my daughter, Dis-Chem Babysitting is the only place where she goes to for her vaccinations, because that's the only place apparently where there's a nurse that doesn't hurt her. So this is now like confirmation from a 9-year-old that that's a place to go to if you don't want to get hurt, is at the Dis-Chem Babysitting for your vaccinations. Keep those up to date, the best prevention. It has been wonderful, and I look forward to next week to chatting to you. The world is changed by our example, not by our opinion. Let's lead by example for our children. Thank you so much for joining me today. Until next week, enjoy your day.